Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. We're joined by Maria. Maria runs her own salon business in Pennsylvania, and she lives with type 2 diabetes. She's joining us to share her personal journey with diagnosis, adopting a new lifestyle, and her experience with a certain type of treatment. She's joined by Dr. Juan Frias, Medical Director of Velocity Clinical Research, Los Angeles. He's going to talk about the relationship between food, exercise, and type 2 diabetes, the importance of having a diabetes management plan, and some information about the safety and potential side effects of Ozempic. Welcome to Health Professional Radio, both Maria and Dr. Frias. Thank you both for joining us.
Good morning.
Thank you. Pleasure to be here.
Dr. Frias, tell us a bit about yourself, and then Maria, briefly tell us about yourself as well.
Absolutely. So I'm an endocrinologist. Endocrinologists generally specialize in seeing patients with diabetes. So I see a lot of patients in my clinic with type 2 diabetes and type 1 diabetes as well. And I also do clinical research. I've researched many medications for the management of type 2 diabetes over the years.
And Maria?
Yes. Hi. And I'm Maria. As you said, I have my salon. I am a mother of two beautiful daughters, and I've been married for 26 wonderful years. And I've been living with type 2 diabetes for the better part of 9 years.
Doctor, what's the difference between type 1 and type 2? I heard you mention both.
Yeah, so type 2 diabetes is the more common form of diabetes. And in fact, if you look at the United States, there are over 35 million people with diabetes. About 95% of those patients have type 2 diabetes. And it's a disorder in which there is resistance to insulin that's made and secreted by the pancreas, but there's also over time a reduction in insulin secretion. Type 1 diabetes is actually an autoimmune disease where the beta cells, or the cells of the pancreas which produce and secrete insulin, get destroyed in an autoimmune process. So patients with type 1 diabetes, and again, this is less common, about 5% of the diabetes, have to have insulin in order to treat the diabetes, whereas in type 2 diabetes, we use lifestyle changes such as diet and exercise, and are very fortunate today to have a number of different medications that we can also offer to patients to help improve their glucose control or lower their blood sugars.
Maria, tell me a bit about your experience with type 2 diabetes. How were you diagnosed? What led to it?
So my journey for actually just being diagnosed was quite interesting. It went about in a very roundabout way. So I actually had a series of symptoms that weren't being pinpointed, and actually they didn't zero in on what it actually was until almost like 5 years in. And funny enough, after that, then, things started moving forward. I did finally find a great treatment plan, which happens to have been, with using Ozempic. But also what was great is that it allowed me to make better choices, and, it motivated me so that I could also do have my exercise and, create a great meal plan, because it just was another tool for me. But the other really cool part was that when I got diagnosed, even though it was devastating and I was really rattled by it, because I do have a long family history of diabetes in my family, which wasn't a positive one. What was interesting for me, and if there's a positive thing about it, was that there's so much better ways to address how you treat diabetes. So, my family got involved. My husband started cooking better. We took dance classes, and even my daughter started incorporating those diet choices. because they didn't want, they know it's in their family, it's in their history. But it's been really great because it was a full comprehensive approach.
Having a family history of diabetes, were these lifestyle changes major? Were you already, relatively cooking well, and did it get kicked into high gear after your diagnosis, having a little bit of warning because of your family history?
100%. In fact, I also had gestational diabetes, so it kind of already was something that I was aware of. And then once this occurred, then we really, and the other great thing was I actually, went to a nutritionist, which also helped a ton, making choices, figuring out what I was going to, what I can incorporate to my meal. And personally, for us, I'm of Hispanic descent, so food is a big part of everything we do. So I needed to find ways that I could incorporate a better diet and still participate and enjoy. And I fortunately have been able to do that, and continuously seeking new ways, better ways to approach it.
Doctor, is Ozempic indicated for people who just can't maintain a healthier lifestyle, or is it something in addition to make those transitions smoother? What is it indicated for exactly?
Yeah, so it's absolutely indicated in conjunction with healthy diet and exercise. So I think what Maria was doing, both with the healthy diet and the new recipes and also with the increased exercise, is critically important in the management of type 2 diabetes. But most patients, in order to control their glucose levels, so to lower the sugar levels, will need medication as well. So Ozempic is indicated as what we call an adjunct, so in addition to diet and exercise, for the management of diabetes type 2 diabetes in adults. And it's also, interestingly, in patients with known cardiovascular disease, it's been shown also to reduce the risk of cardiovascular events. So this would be heart attacks, for example, stroke, and even cardiovascular death. So that is the indication, in conjunction to diet and exercise, to lower glucose in adults with type 2 diabetes.
Talk about the safety and some of the possible side effects that people should consider when using Ozempic.
Yeah, so it has what we call a boxed warning, which speaks about the potential for thyroid tumors. This is a very rare tumor called a medullary thyroid carcinoma. So it's contraindicated. Patients either with a family history or a personal history of medullary thyroid cancer or a condition called MEN2 should not use Ozempic. But the most common side effects are what we call gastrointestinal in nature. So this would be potential for nausea, vomiting, diarrhea, abdominal pain, constipation. But these patients should talk to their doctor, not just about their treatment plan and whether Ozempic is an option for them to manage their diabetes, but also discuss these potential side effects. Because oftentimes, and most often I would say, we can work through these through dietary changes and sometimes medication. But these are the most common side effects.
Maria, where can our listeners go and learn more about Ozempic?
Oh, well, definitely you can go to Ozempic.com. And you can see more about the actual treatment. But I highly recommend that you consult with your physician and ask them if they think that that's the right treatment for you. Your physician is always going to be the best resource.
Great. Maria, Dr. Frias, I appreciate both of you lending us some of your time this morning. Thank you so much for joining us here on Health Professional Radio.
My pleasure.
My pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Juan Frias and Maria. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our YouTube channel at youtube.com/Health Professional Radio.